Okay, my name is Dr. Barry Taylor. I'm the radiology consultant in the radiology department at InterHealth. This is new exciting times for our department. We're currently upgrading our MRI and as well as CT. The first project is the MRI system, where we're getting a new machine. We're going from a 0.3 Tesla to a 1.5 Tesla. Basically, it's just improving the software significantly. Okay, what we can expect for the patient is a significantly improved experience. Instead of, for example, an MRI brain, which was originally 45 minutes, now scan times will go down to at least 8 minutes. From now, we can maybe do 8 scans per day, but with a significantly reduced scanning time, we can accommodate a lot more studies in the actual day. That way, patients that have been waiting for their studies for a period of time, we'll be able to facilitate them to reduce the time taken for them to come to a diagnosis. So this would significantly improve even the outside clinicians as well as our hospital clinicians being able to figure out what's wrong with the patient much earlier. That way we can get treatment to them as quickly as possible. So this is a significant improvement for the system overall.
Patients are claustrophobic. So I think with the new machine, because we'll be able to have shorter scan times, there are other details about the machine that will make the exams more calming for the patient. Again, better image quality, and I think they'll enjoy the fact that this new machine will basically make the exam easier for them as well as for us. I'm very excited to be building new skills. Even though I already do MRI, there are a lot of exams that we will be able to do that we currently aren't able to do. So I'm excited that we'll be able to learn more things, and equally excited that my other colleagues will have the opportunity to learn as well.
This new technology, this machine is one of the greenest MRIs on the planet. It has self-contained helium, so we don't have to worry about refilling it. It also is projected it will last at least 10 to 15 years. It has the ability to be upgraded anytime GE comes out with software upgrades, but the basic upgrades are included with the first price that we've paid for the MRI. We will be able to do a lot more MRIs that are currently not being able to be performed. This machine will be so quick, we'll be able to perform breath hold sequences, which what that means is we'll be able to perform abdomens. We can do MRAs without using contrast. So renal patients will have the opportunity to get their venous system, their arterial system imaged without having to have contrast, which is very important because a lot of times they can't have contrast. Some of the breasts are very dense when they do a mammogram. The MRI could supplement that to give the radiologist more information without having to send the patient off island to get the MRI of the breast, in conjunction with the ultrasound and the mammogram. The 1.5 Tesla MRI, which is 5 times stronger than the current MRI we have, will be able to give us 40% more detectability, 40% more diagnostic ability, and it will probably be 60% quicker than what we're currently able to do. The speed in itself will make it more diagnostic, because when you're in there for an hour and a half doing a scan, it's hard to lay still. It's hard for me to sit still for 5 minutes, much less lay still for an hour and a half. So the images will be much better because there won't be motion on the images. The radiologist will be able to provide a better report, and it will be done quicker. The artificial intelligence gives us as the technologists the ability to basically sit down at this machine, having never used it before, pick the body landmark that we need to scan, and technologists that are already trained in MRI have been able to use it without any additional training. So all of us that are already trained in MRI will be that much further ahead, and when the application specialists from GE come, they will be able to advance us even more than we already are. So it'll be fantastic. The artificial intelligence also helps the radiologist in interpretation. It gives the images much clearer, much cleaner, so he doesn't get artifacts, which is noise on the images basically.